The spinning sensation of the head, where you feel the world around you is also spinning, and the feeling of loss of balance. This condition is known as vertigo. Vertigo is usually caused because of infections of the ear, due to migraine kind of headache, because of side effects of some of the medications, and some of the underlying health issues. There is one kind of vertigo which is commonest of all, that is known as benign paroxysmal possessional vertigo. This kind of vertigo is common in older age group of people. What happens in this is, when there is change of position of the head and neck, there is vertigo which is associated with nausea and vomiting also. Now, change in the position of head can be in any of the direction, from sit to stand position while lying on the bed, and from waking up from the lying position. Just with the normal basic movement of the neck also, you can get this BPPV. As I said that this is common in elder age groups, what happens is, as vertigo can cause fall. Now, elderly people, they already have osteoporosis. Their bones are very brittle already. So when there is fall, there is a high risk of fracture. So other than the risk of fall and injury, there is not much to worry about this kind of vertigo. So, but yes, the worry thing will be there if the vertigo is associated with loss of consciousness, visual disturbances, impaired speech, and limb weakness, as this can be because of other kind of related issues. So that has to be intervened clinical very quickly. Now, vertigo. What can we do to treat this vertigo? Firstly, the thing we can do is treat the underlying cause. If the vertigo is happening because of some other problems, that problem has to be cured so that the vertigo will go by itself. Next thing is balance training. There are the certain ways of doing the balance training, and there is something known as vestibular rehabilitation therapy. So the advantages of this VRT is it improves gaze stability. So coming to gaze stability, what happens in vertigo is, especially in BPPV, there is the movement, continuous movement of the eyeballs. There is continuous movement of the eyeballs, which is also known as nystagmus. So while doing VRT, while doing vestibular rehabilitation therapy, it improves the gaze stability. It improves the eye movement. That is there. It improves the posture. There is improvement in the posture and improves the vertigo overall. So now I will be showcasing some of the exercises which you can easily do it at home to treat yourself if you are facing the problem of vertigo, or your parents or your grandparents if they are facing it too. So let us begin. Very simply, first, upright, straight posture. Your head and neck has to be straight. For this, you can use a mirror for the feedback. Just take a pen, stabilize it. You can do this by yourself, or a colleague can help you to do so even. So yes, let us begin this. Now, you will not move your neck. Your neck is very straight. Just move your eyes where this pen is going to. So you can do this right, left, up, down, and diagonally. So both sides, yeah. So this can be repeated 5 to 10 times and can be increased later on. So the next thing what you can do is same thing with the pen. Now it will be just the opposite. Take the pen, stabilize the neck, stabilize the gaze also, means look onto the pen only. Now without altering the gaze, move your neck right and left, but you have to look onto the pen only, onto the stabilized object only. Other thing what you can do is just move your neck right, left, up, down, and lateral ways. Now what does this do is it helps in coping up with the situation. It helps in improving the vertigo. It makes your body do it again and again so that your body, it balances the activity. Now, one more thing what you can do is sit upright, and then you can sit on a chair for this. What you can do for that is sit on a chair and then just look down, up, right, down and up. For this to maintain a feedback, what you can do is just touch the floor on the right side, come up, touch the floor on the left side and come up. But that doesn't mean you just touch it with a hand with looking straight. There has to be your neck has to be bent, so there has to be the movement of your eye and neck also. So just go down, touch the floor, come up. Same on your left side, and you can do it in the front also. So these are the basic things by which you can improve vertigo, improve the gaze stability, and yes, by this you can help yourself and help others as well. Thank you.